The moment you bring in the Virgins, the Sercos, the United Healths of this world, they have a legal obligation to their shareholders to maximise profit. And so their aim is really to extract as much profit from the NHS as they can. In fact, there's a McKinsey document somewhere over the years which specifically talks about this, about turning the £100 billion NHS into a £200 billion business, effectively.
A private market.
Yeah.
When you're dealing with a market, you're dealing with consumers and providers, okay? And you're assuming a similar level of experience and understanding between those consumers and providers. This is something which does not exist in healthcare. There is an asymmetry.
Yeah, you see these examples very directly in the US in terms of healthcare fraud. There's been a number of kind of cases where doctors have prescribed toxic treatments such as chemotherapy completely inappropriately because of that profit motive. But on the bigger scale, you see that the big players, for example, United Health, the biggest American private healthcare and insurance company, the biggest in the world now, they've been engaged in one scandal after the next. But what we see is that it's not just what you're doing with that level of privatized healthcare insurance is you're denying care, you're screening patients, excluding the poor and the sick, which tends to go hand in hand. You're paying exorbitant fees to your executives, and you're engaging in healthcare fraud. So you're inflating billing, you're over-diagnosing, over-treating. So that's where some of your profit really comes from.
And Youssef's mentioned care denial. And care denial is absolutely central, not only to the American model, but also to what is happening here. So again, I refer to the Adam Smith Institute's document from 1988 when they talk about the success of HMOs, the health maintenance organisations, which we know were a pet project of Nixon's. And they talk about their success in terms of the savings made, that patients go to see their doctors less, and when they do go, the appointments are shorter. So they're actually actively denying care. And these are a group of healthcare firms which agree to take up responsibility for providing healthcare for a given population over a defined period of time. And incidentally, these contracts are going to be for 10 years with a defined budget. So rather than paying for a treatment for a patient, a population will be given a budget. And therefore, care denial becomes essential to that model.